everyone, and welcome to Behind the Numbers. I'm Dave Bookbinder. I'm a senior director at CFGI, and this is the program where we dig deeper to understand what matters most in business. Today, I'm excited to welcome my guest. It's Mike Coppa from RSM. Mike's a healthcare partner there. Mike, welcome to Behind the Numbers.
Awesome. Thank you, Dave. Yep.
Great having you here. Why don't you tell the audience a little bit about who you are and maybe just a bit about RSM?
Yeah, certainly. Again, my name is Mike Coppa, partner at RSM in our healthcare practice. It's a national practice all across the U.S. I lead services really in the Northeast. I'm based in Edison, New Jersey, but I spend a lot of time in pretty much all of Eastern Pennsylvania, all of New Jersey, and I have several colleagues up through the rest of the Northeast, New York City and north, where we cover a lot of different healthcare providers, all on the provider side versus the regulatory side. But that's inclusive of hospitals and health systems, medical practices, some on the smaller side, but also large multi-state medical practices, long-term care, mental and behavioral health, really a diverse representation of the healthcare provider industry. As far as RSM is concerned, for those who may not be as familiar, we are the 5th largest firm in the country. Healthcare is one of our priority industry verticals, but we certainly serve other industries fully across our accounting, audit and accounting, tax, and advisory services. So certainly excited to be here today, talk a little bit about the industry. Obviously, there's always so much going on in the healthcare industry, which is one of the reasons why I've pretty much dedicated my pushing 20-year career to serving the industry. There's always something going on, something always dynamic about it. And myself and all of my colleagues at RSM are constantly learning and figuring out what is best for our clients and bring them those ideas and thought leadership to help them through the challenges that they face on a day-to-day basis.
Well, we're thrilled to have you here. So,
Excellent.
and healthcare is a topic that resonates with everybody, whether you're in business or not in business, what have you. We're all faced with healthcare issues and dealing with the system, right? So what I thought I might do is start out by asking you about how healthcare companies get paid. Maybe you can demystify that, talk about the economics from the business side, and maybe dovetail that so that from a consumer lens, we can connect the dots and see how it might make sense, if it makes sense.
Yeah. There's a variety of ways that they get paid, but I think most traditionally, as it stands now, they get paid on what's called a fee-for-service basis. So effectively, you go in for whatever it is, a heart repair or a knee replacement or something along those lines. There are things that they need to do to get that work done. There are billing codes associated with each piece of what they're doing. And generally, whether they're being paid by some type of commercial insurer like a Aetna or a Blue Cross or something along those lines, or they're getting paid by a governmental body, Centers for Medicare and Medicaid Services, Medicare and Medicaid reimbursement, they're essentially going to get paid some negotiated rate of what that insurer is willing to pay for those services. To the extent that you don't have insurance, you're essentially paying out of pocket. But hopefully, people have insurance because some of this stuff is a little bit costly. So those rates and those negotiations between the payer and the provider does create some ambiguity for the individual consumer, the patient, because they may see and get a bill for a charge that is far in excess of what that provider actually gets paid. So there's a lot of initiatives going on right now to try to demystify, be more transparent in what that billing relationship looks like. So there's a deeper understanding from the consumer level of what services am I getting, how much does it actually cost, how much are they getting paid, how much is my insurance company paying them, which puts a little more power into the individual patient. But that overall, that's one of the most common ways that these providers get paid. And there's other ways that arrangements that they make with insurers and and the like in the patient, value-based care, things along those lines, kind of set payments for, outcome-based results versus actual, hey, look, I saw you for the flu and I gave you a prescription and you went on your way. It's more, there's other arrangements where it's more holistic about the health of the patient itself, which get a little more complicated. But in general, you do service, there's an arrangement with an insurer, they pay their portion, there might be some portion paid by the individual, and that's generally how it works in the industry.
Yeah, can we talk about surprise billing? I know from experiences where maybe, for example, you go in for a colonoscopy and you think that there's a fee for service, but then you get a surprise bill from an anesthesia department that may not necessarily be a part of that facility. Talk about surprise billing and how's it happen and what can be done about it?
Yeah, and that's part of the challenge for the consumer is they don't necessarily on the surface know all the different players involved in the service. So like for your example, you're going in to see a ear, nose, and throat, and they got to put you under, and an anesthesiologist comes in and does their work. You don't necessarily realize all the time that anesthesiologist may actually be part of a separate medical practice and has some type of arrangement with that ear, nose, and throat doctor when anesthesiology services are needed to come in and provide that service. So you're here as the consumer, you're thinking all of my charges are going to be coming from, my care physician there who's dealing with my ear, nose, and throat issue, and all of a sudden you're getting these bills from another practice. So, that's certainly a point of emphasis, to make sure that, patients are aware of, again, what's all involved with the service, who's all involved in the service, where the bills are going to be coming from. And you're seeing it now in the hospital and health system space where they talk about that pricing transparency. It's really kind of what they're getting at is, to be very clear and upfront, so you can kind of compare amongst providers, what those charges are going to be and what that cost of service is going to be holistically, so you don't get those bills that you're not expecting, and you can compare it to other providers to say, maybe I don't want to go here anymore. I want to go somewhere else where it's a more reasonable cost to me personally out of my pocket and to my insurance provider. So that transparency will trickle down, whether it's by regulation, like it has been with the hospitals and health systems now, or by force of the consumer, demanding that type of information so they don't have these billing issues that have crept up, especially over the past 5 or so years, 5 to 10 years.
How about healthcare as an investable space? We've got about 5 minutes to go in this segment, so I want to just start this here. But as an investable space, is it a good opportunity for folks like private equity, for example, strategic buyers, as another example, to be looking at transactions in healthcare?
Yeah, I mean, there's a lot of opportunity there, and we see a tremendous. I spend a ton of my time in, kind of that private equity, home office backed ventures where they're gobbling up, medical practices and market share in all kinds of disciplines. It could be physical therapy, it could be pain management, it could be cardiology, ophthalmology, you name it. Where they think they have an ability to, create a platform and grow that platform over some geography and create some level of economy of scale. So there's a nuance to the way that they make that investment, but certainly it's getting harder to operate as a sole practitioner or even just a small office. So the idea of affiliations, whether it's with a health system like here in Jersey, Virtua or something like that, or you have some other investors through the vehicle that they make these investments happen, create that scale, cut down the overhead of the administrative burden in doing so, and kind of getting a more efficient platform to deliver these services, and also by doing that, kind of create a bigger bargaining opportunity with the way that payers arrange reimbursement with them and things along those lines. So certainly you pick the discipline, whether it's primary care or things that people traditionally think of when in healthcare. They're also investing heavily in behavioral health and mental health and health and human service related providers. So all of it with that idea of, if we do what we're doing and we're passionate about, and we do it very well, and we can do it on a large scale over a large geography and have that muscle of being able to kind of negotiate, what our fee for these services are going to be or what our reimbursement looks like for these services while driving down the total, administrative burden. Tremendous opportunity, from an investment standpoint.
Mike, before we take a quick break here, why don't you tell the audience how they can contact you if they want to learn more about you or how to work with you?
Absolutely. So probably the easiest ways to contact me is by email, which is mike.coppa, M-I-K-E, .coppa at rsmus.com. You can reach me on my direct dial, 732-515-7308. Or you can look up my LinkedIn profile, Michael, M-I-C-H-A-E-L, Coppa, C-O-P-P-A. You can look me up on LinkedIn and you'll see RSM partner, that's me.
There you go.
And you can reach out.
And he looks just like that. We're going to take a quick break here on Behind the Numbers. We'll be right back after this quick commercial word. Don't go anywhere.
So, I got this new family, and I don't know what it is about this one, but she can't seem to put down that toy all day long. Tap, 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 tap. Oh, and she even talks to it. She talks to that more than she talks to him. What's up, bro? Nice shirt. Who's she talking to? Her mom? She talks to her mom a lot.
Why buy local? When you shop with local businesses, you're spending your money on more than just the item you're buying. You're adding a building block to your neighborhood. It starts with a single purchase, maybe a cup of coffee, groceries from a local co-op, or even a shiny new bicycle from one of the nearly 28 million small businesses nationwide. Your money doesn't stay in the till for long though. Local business owners use the money to create a lot of economic activity in your neighborhood, like buying from suppliers, many of whom are also local businesses. Paying taxes to the city, which builds and maintains the infrastructure we all rely on. Employing local workers, contributing to 65% of the net new jobs each year. Add this all together and you've got a recipe for a happier, healthier, more connected neighborhood. Now that's an investment worth making.
Welcome back to Behind the Numbers. I'm Dave Bookbinder, and today we're talking about healthcare with Mike Coppa, who's a healthcare partner at RSM. Mike, we ended that first segment talking about the investable space of healthcare and how private equity is involved with it and so forth. Why don't we talk a little bit more about that topic here as we kick off the second segment, and talking about facilitating the transaction, things like the integration process, the diligence process, and where do things go sideways? What can the audience learn from your lens as to how to keep these things on track?
Yeah, and really it's even beyond just the private equity groups getting involved. Really what you're asking can be uniform to whoever is making that making that purchase or looking to make that purchase. It could be nonprofits looking to acquire another nonprofit. It could be a nonprofit health system looking to acquire a historically for-profit medical practice or something along those lines. All of which is happening right now, and many of which have a common potential pitfalls. That doesn't matter who's buying who or who's merging with who or who's affiliating with who. That they need to to really be thinking about if they really want to capture what they think the synergies are going to be between the organizations and that boost to their already existing platform that they're trying to achieve. So, one of the biggest things is, really making sure you're spending time on the diligence. And a lot of people, when you talk about diligence, they automatically say, let me look at your balance sheet, let me look at your income statement, what's your trailing 12 months revenue stream look like, and that's all very good stuff. But really, what's driving these businesses is that nuance of how they encounter a patient, how they deal with their payers, how they bill their insurers, all of those things. So if your diligence is not inclusive of kind of looking for skeletons in the closet of what's going on with their payer arrangements, is this, insurance contract, is it sustainable? Is it, is it going to be due, is it going to be void sometime soon? Do they have billing issues? Are they under audit or investigation by these payers or some regulatory body or something along those lines? To really expand that diligence beyond your waterfall analysis or something like that, to really understand what's going on in their coding, documentation, and billing cycles. If it also going beyond just the balance sheet and income statement and looking at what technology are they using? Can it be integrated into what we utilize as a system or as a practice or whatever the case may be? They may be on antiquated EHR platforms, electronic health records, or electronic medical record platforms that will not play nicely, and information is not easily extractable that can be brought into a new environment. That doesn't necessarily preclude you from making those acquisitions, but it's certainly something you're going to want to know on the front end, both when you're pricing it and understanding what kind of cost it's going to take to get that integrated into your system. Obviously tax is very important, and overall compliance. Are there privacy issues with healthcare information, HIPAA? Are there other Department of Justice investigations, things along those lines. So really understanding holistically when you're talking about the medical field and the healthcare industry as a whole, understanding what you're buying, because there's indemnifications and all those things that could be put into these buy-sell agreements, but at the end of the day, you're still dealing with what's going on, and that could have reputation risk and all those things, even though maybe your investors aren't paying for the outcome. But taking that time, really making a robust diligence process, understanding what you're buying, pricing it correctly, and having a 100-day plan or whatever you want to refer to it as, of really bringing that on board without significant disruption to your existing operations. That's really what you need to be thinking about, and not just, we're going to do a very quick and dirty, financial analysis and call it a day. And maybe sometimes that's right for the very small acquisitions, but you're looking to do anything sizable, move into other states, things along those lines. You really got to be thinking about it holistically. It's a little bit different than some other industries. There's so many regulatory bodies and arrangements and people involved, stakeholders involved, that it's worth taking the time to make sure that you get your value on the back end. And I've seen it numerous times where that level of care wasn't taken, and they bought things that did not quite pan out, the way that they were hoping, which drains the entire company, not just what you bought. So
much complexity, so many different layers. What's the pandemic done to throw yet another curveball into that whole mix? From my particular point of view and the direct client base that I served, I think, in the early stages of it, it slowed things down tremendously. There was almost every single one of my clients had some type of M&A activity on their deck, in February, March, April, that as the pandemic unfolded and, people started to realize this was going to be a little longer term than maybe what was initially anticipated or at least hoped for. That whole M&A environment slowed down. And I would say probably until about midsummer,
you saw it starting to pick back up again. And right now, it is on fire as far as my perspective is concerned. There is just so much interest in this particular space, and I think it's just a combination of what's going on in the political environment and changes that are on the horizon for the industry. I think just there's, whether it's dry powder or whatever you want to refer to it as, I think there's money laying around that people want to get into play, and there's some really good opportunities out there in the healthcare industry. All of what we talked about today, not just one specific part of it. That as we look to close out the year, even with the pandemic still going on, there is a push to get some of these deals going and closed as soon as possible, even if you have to do the diligence in some type of remote capacity or something along those lines. Where you have to have things, there are certain deals that are in place that I know of that are you need to have some level of in-person reviews and things along those lines, and other regulatory bodies. They're still being held up because obviously not everybody is back to work and face-to-face and things along those lines, but there's no lack of interest to make that happen once all the green lights are in place to have it go down. So the pandemic slowed things down, but I think also has created kind of a lot of pent-up excitement about these investments. And I think if you do your diligence and price it right, which I'm sure there'll be some competition out there to close some of these deals. But I think if you align with your investment strategy and stay on course and do your diligence, there's some good deals out there to have.
Yeah, Mike, what's the best way for folks to contact you if they want to learn more about that?
Again, I think it's the email address, mike.coppa, mike.coppa@rsmus.com. My direct dial 732-515-7308, or you can find me on LinkedIn, Michael, M-I-C-H-A-E-L, Coppa, C-O-P-P-A, on LinkedIn, partner at RSM. So.
Yeah, Mike, we've got just a couple of minutes to go here in the program, and I want to try and squeeze in just a little bit more here and kind of dovetail a couple of topics, maybe telehealth and mental health, if it makes sense to dovetail the two. But from the perspective that right now in the middle of a pandemic, mental health is forefront in everybody's mind. Everybody's dealing with something, and in some instances you can't access your relatives, for example, if they're living in a nursing home or an assisted living facility, and telehealth has become such an important component of that. Talk a little bit in the 4 minutes or so we have here about the telehealth and mental health component of healthcare right now and where that's headed in your view.
Yeah, so from my view, telehealth is here to stay. It was not an easy feat pre-COVID. There was a lot of state-by-state regulations around it. There was a lot of reimbursement challenges around it, all of those things, much of which, at least for the time being, supposedly is a temporary alleviation of those barriers to telehealth. And telehealth, even though as the pandemic has worn on, it has lessened the number of encounters from telehealth, but still up from what it was pre-COVID. So I think by and large, everybody thinks telehealth is a significant component to the future of all providers, especially in the emphasis on mental and behavioral health. Obviously, people are very challenged right now in those departments, turning to drugs and alcohol and other matters. With what's going on here, there's bouts of depression. There's all kinds of things going on. There are still adults and children living with disabilities, intellectual disabilities, all of those things. A pandemic does not stop what these people need on a day-to-day basis. And many of our clients in this space, to a certain extent, are busier than they've ever been. And telehealth has been a significant component of making that happen when they can't see people face to face. And I think it's also telling the lesson of you don't necessarily need to see somebody face to face, and there's certainly things that can be done effectively in a remote environment. So I think what's going to happen, and a lot of my colleagues agree, telehealth and the regulations around it, the reimbursement ranges around it are going to be more favorable and continue to be favorable going forward. Maybe not exactly how it is right now, but when you think about what the future of healthcare looks like, that it's going to be, more consumer-based, more on demand. The way you get paid is going to be more for the value that you bring to the patient. Telehealth is a significant component of achieving those goals and making sure that the people that you care for, the patients that you care for, the family and children that you care for are cared for properly and have very positive outcomes when they do encounter you.
Great. Well, on that note, unfortunately, we're out of time. Mike, thank you for joining us today on Behind the Numbers.
My pleasure. Thank you.
And thank you at home for watching and listening. Please be sure to hit the subscribe button to know what we're up to going forward. I'm Dave Bookbinder. You can find me on LinkedIn, Facebook, and Twitter. Let's chat sometime. You take care, stay well. We'll see you next time on Behind the Numbers.